Take a moment with me before you scroll away. Let me ask you something gently. Have you ever noticed that even when your weight hasn't changed much, your belly feels deeper, firmer, harder to lose? Not soft, not pinchable, just there. If that sounds familiar, I want you to know something right away. You're not lazy, you're not broken, and you're definitely not failing. What you're dealing with is something very specific, very real, and very common. It's called visceral fat. And today I want to talk to you about the fastest real way to shrink it. Not hype, not detox myths, not extreme plans, but what science actually shows works and why. Stay with me. This matters more than most people realize. Now, let me slow this down and speak to you the way I would if you were sitting across from me in my clinic. Visceral fat is different from the fat you can grab under your skin. It lives deeper, wrapped around your organs, your liver, pancreas, intestines. You can't see it directly, but you can feel its effects. And here's the honest part. Visceral fat is not just about appearance. It's metabolically active. It releases inflammatory chemicals, disrupts hormones, worsens insulin resistance, raises blood pressure, and quietly increases the risk of heart disease, diabetes, fatty liver disease, and even certain cancers. That sounds heavy. I know. Take a breath with me. The reason I'm telling you this isn't to scare you. It's because visceral fat responds remarkably well to the right changes, often faster than any other type of fat in the body. And that's where hope comes in. Now, many people come to me frustrated. They say, "Doctor, I'm eating less, I'm exercising, but my belly won't go away." And I can hear the discouragement in their voice. So let me explain what's really happening clearly and calmly. Visceral fat grows primarily in response to three things: chronic insulin elevation, chronic stress hormones, and inactivity that keeps muscles metabolically quiet. This means that simply eating less calories or doing endless cardio or doing random workouts often isn't enough. The body doesn't shrink visceral fat when it feels threatened or stressed. It holds onto it. So the fastest way to shrink visceral fat is not punishment. It's not extremes, it's creating a metabolic environment where your body feels safe letting it go. Let's talk about how that actually works. First, insulin. Every time you eat foods that rapidly spike blood sugar, refined carbohydrates, sugary drinks, frequent snacking, insulin rises. Insulin's job is to move glucose into cells, but it also sends a powerful signal to store fat. Visceral fat is particularly sensitive to insulin. When insulin stays high throughout the day, that deep belly fat gets constant reinforcement to stay exactly where it is. So the fastest way to shrink visceral fat begins with lowering baseline insulin levels, not starving yourself, not cutting everything you enjoy, but giving your body longer periods where insulin can fall. This is why approaches like time-restricted eating work so well for visceral fat. Not because of magic, because insulin finally gets a chance to rest. When insulin drops, something important happens. The body switches from storage mode to fat-burning mode, and visceral fat is often the first to respond. Now, I want to be very clear here. This does not mean extreme fasting. This does not mean skipping meals until you feel weak or dizzy. For most people, simply consolidating eating into a consistent 8 to 10 hour window already creates a measurable reduction in visceral fat within weeks, not months, weeks. I've seen this repeatedly in clinical data in real patients. Now let's talk about stress, because this part is often overlooked. When you're under chronic stress, emotional stress, work stress, sleep deprivation, your body releases cortisol. Cortisol has a direct preference for increasing visceral fat storage. From an evolutionary perspective, this made sense. Deep fat protected vital organs during perceived danger. But in modern life, that same response works against us. So if someone is doing intense workouts every day, undereating, sleeping poorly, and living in constant pressure, their cortisol stays high, and visceral fat stays right where it is. This is why the fastest way to shrink visceral fat often includes doing less, not more. More recovery, more sleep, more consistency. I know that sounds almost too simple, but biology is often simple when we stop fighting it. Now let's talk about exercise, and this is where many people are surprised. Long, slow cardio has benefits, but it is not the fastest way to target visceral fat. The research is very clear on this. Short bouts of resistance training and high-intensity intervals create powerful metabolic signals that specifically reduce visceral fat. Why? Because muscle tissue is metabolically expensive. When you activate large muscle groups, legs, glutes, back, chest, the body improves insulin sensitivity and burns fat more efficiently at rest. You don't need hours, you don't need complicated routines. 20 to 30 minutes, 3 to 4 times per week, focused on strength and brief intensity, consistently outperforms daily long cardio for visceral fat reduction. And here's something reassuring. You don't need to be young. You don't need to be fit already. Visceral fat responds at any age when muscles are engaged properly. Now, let me slow down and say something important, and I want you to really hear this. You cannot out exercise poor sleep. Sleep deprivation increases hunger hormones, worsens insulin resistance, raises cortisol, and directly increases visceral fat accumulation. This isn't about willpower. This is about physiology. People who sleep less than 6 hours per night consistently have significantly higher visceral fat levels, even when calorie intake is controlled. So if you're exhausted, pushing harder is not the answer. Rest is not weakness, it's treatment. Now let's talk about food quality, not dieting, not restriction, but signals. Protein is one of the strongest signals to reduce visceral fat. It stabilizes blood sugar, reduces cravings, preserves muscle, and increases thermogenesis. Fiber does something similar. It slows digestion, feeds beneficial gut bacteria, and reduces insulin spikes. When meals are built around adequate protein, natural fiber, and healthy fats, visceral fat loss accelerates even without strict calorie counting. And here's something I want to gently correct. You do not need to eliminate carbohydrates completely. You need to choose carbohydrates that don't overwhelm your system. Whole foods, vegetables, legumes, fruit in appropriate portions. The problem is not carbs themselves. It's constant spikes, constant grazing, constant insulin elevation. Now, there's another factor we need to talk about, honestly: alcohol. Alcohol has a direct and disproportionate effect on visceral fat. Even moderate intake increases liver fat, insulin resistance, and abdominal fat storage. This doesn't mean never enjoying life again, but if someone is serious about shrinking visceral fat quickly, reducing alcohol even temporarily makes a dramatic difference. I've seen visceral fat measurements drop significantly within a month when alcohol is removed. Now, let me pause here for a moment, because at this point, some people feel overwhelmed. If that's you, take a breath. You don't need to change everything at once. The body doesn't need perfection, it needs consistent signals. Even one or two of these changes can start the process. Now, let me tell you something encouraging. Visceral fat is more responsive than subcutaneous fat. It shrinks faster, it improves metabolic health quickly. People often notice improved energy, better blood sugar, reduced bloating, and clearer thinking before the mirror even changes. Those are signs things are working. Now, I want to address supplements because many people ask about them. There is no supplement that replaces lifestyle signals. Anyone who tells you otherwise is not being honest. That said, certain nutrients can support the process: omega-3 fatty acids, adequate vitamin D, magnesium for sleep and stress regulation, but they are support, not the driver. The driver is behavior that lowers insulin, reduces cortisol, and activates muscle. Now, let me say something directly to you, and I want this to land with calm seriousness. You do not need to punish your body to change it. Your body is not your enemy. It's responding exactly as it was designed to respond. When you work with its biology instead of against it, visceral fat loss stops being a battle and starts becoming predictable. And that's empowering. Now, if you're wondering how fast results can happen realistically, here's what science and clinical experience show. Measurable reductions in visceral fat can occur within 2 to 4 weeks. Not dramatic transformations, but real internal changes. Over 3 months, the difference can be profound, not just in appearance, but in blood markers, energy, and long-term health risk. This is not about looking a certain way. This is about protecting your organs, your metabolism, your future. And you deserve that. Before we close, I want to leave you with reassurance. If you've tried before and it didn't work, that doesn't mean you failed. It means the strategy didn't match the biology. Now you understand the difference. Go gently, be consistent, respect your body's signals. Visceral fat is not permanent, it is responsive. And with the right approach, it will shrink. I'm glad you spent this time with me. And take care of yourself calmly, patiently, and with trust.